It's normal for children to daydream during class, occasionally forget their homework and get fidgety at the dinner table. But sometimes these children are seen as naughty and undisciplined when in fact they could have attention deficient hyperactivity disorder. Due to the media's vast portrayal of ADHD, it's easy to be misguided by unqualified opinions, myths, even half-truths instead of knowing the facts. Now, joining us today in Pretoria is General Practitioner Dr Shirley Anne Jourdan, who focuses on assisting families with ADHD challenges. Good morning to you, Dr. Jourdan. Thank you for joining us.
Thanks, Eben. Thanks for having me here this morning.
You know, in a recent article published online, I can't really say who it was.
Sure.
It says it was on medicating children with ADHD. It stated that South Africa has one of the highest rates of prescribing medication for children with ADHD in the world, with South Africa's figures exceeding that of the United States. What do you make of that sort of thing?
Eben, unfortunately, we don't have official statistics here in South Africa, and little is known about ADHD on the African continent. But there was research done by Prof. Anneke Meyer, and she did a study cross-cultural over several language groups. All the questionnaires were translated into most of the 11 official languages, which showed that the prevalence seems to appear similar to that of Western countries and international standards, somewhere between 5 and 10% of all school-going children. But we don't have official statistics, and prescribing data is not officially published either.
You know, the media, they're quick to point a finger at the doctors and saying, yes, doctors are very quick to prescribe medication for ADHD when children are, in fact, maybe a little bit talented. I mean, in my case, I probably would have gotten ADHD medication back in the day.
True, Eben, and look how you've used your talent to be on Newsroom. That's probably why you do the short reports and not the long reports, Eben. Yeah. Quick, to the point, and the bottom line. These children are not untalented. They often are just misunderstood. I'm more concerned about that which is being underdiagnosed. And yes, there are studies that show underdiagnosis as well as overdiagnosis and misdiagnosis. But I'm very concerned about the children that are called lazy or stupid or unmotivated or defiant, just because they're not able to channel their attention or sustain their attention and comply. It affects them not only academically but also behaviorally and socially. And I'm more concerned about the damage that's being done by not recognizing this very real and dangerous, potentially dangerous condition.
You talk about undiagnosed, and I suppose there are quite a few conditions that could be undiagnosed. Even something like dyslexia, you know, where children are called stupid and the like. As a parent, how do you go about finding out what your child, if your child has an issue?
Right. Yes, there's several conditions that may masquerade as ADHD. Not everybody who struggles to sustain their concentration or who fidgets has ADHD. There may be several reasons for it, including medical, neurological, learning disorders, as you mentioned, dyslexia, that may look like ADHD. And it's important to have a very thorough assessment by a group of well-qualified therapists and doctors and the like.
Now, Dr. Jourdan, how do you distinguish between a naughty child, a common naughty child, and somebody who actually needs medication?
Right, the criteria are quite specific. You need at least 6 of the criteria in the inattentive category or in combination with the hyperactive impulsivity criteria. It's well stipulated in the DSM-5 criteria. And of course, it's based not just on tick lists, otherwise we could diagnose over the internet, but based on a clinical interview. And the assessment needs to be done with a parent interview because the parents know their child the best, as well as questionnaires from the teacher. There has to be symptoms of this condition in more than one setting. If it's only appearing in the classroom, there might be other reasons. There needs to be some of the criteria for longer than 6 months in a persistent form which are not appropriate for their developmental age or development.
And how do you deal with a scenario like I've had in my family recently where the teachers are pushing for a child to go on ADHD medication?
It is not for the teachers to make a diagnosis, but our teachers are the ones who spend a lot of time with our children in a very challenging setting, often with a large classroom with lots of stimulus that they need to deal with. So it's important to take cognizance of what the teachers are picking up. They can at most say these are red flags as to that there might be problems with your child reaching their potential, either academically or behaviorally or socially, and to then refer appropriately. But it is not for the teacher to insist on medication at all. That is something that the parents need to decide with, along with the treatment team, to have a well-informed decision-making team and a thorough assessment before we go that route.
Well, Dr. Shirley Anne Jourdan, I thank you very much for joining us today. A very insightful interview around ADHD medication. It should be in more than one place, not only in the classroom. Your child could just have been like I was in school, a little bit naughty.